Effective infection control requires diligent application of evidence-based practices. You'll learn practical techniques for hand hygiene, including proper hand washing and the World Health Organization's 5 moments for hand hygiene compliance. Mastering the gold standard for infection prevention, selecting and using protective equipment correctly, maintaining safe clinical environments, and understanding resistance and safety measures are key components. Compassionate care delivery involves understanding the crucial difference between sympathy and empathy, recognizing emotions without becoming overwhelmed, and managing personal feelings while maintaining professional boundaries. Emotional labor is a legitimate aspect of healthcare that requires support and recognition, and developing strategies to manage it is essential for maintaining genuine care. Clinical governance and safety are paramount in healthcare settings. Documenting errors, near misses, and adverse events through incident reporting, identifying underlying factors through root cause analysis, promoting open reporting without blame to foster a safety culture, and implementing changes for quality improvement are all vital steps in ensuring patient safety and care quality. Electronic record keeping is crucial for maintaining data security and efficiency in healthcare settings. Understanding how to access, input, and retrieve information while adhering to documentation standards and legal considerations ensures that records are accurate and traceable, which is essential for patient care and legal compliance. Multidisciplinary team working involves understanding the distinct contributions of different healthcare professionals and mastering structured approaches to effective interaction. Developing professional communication skills and contributing to collaborative care planning processes are essential for bringing insights from different patient care to inform decision-making. Community healthcare support focuses on ensuring safety and providing resources for home settings. This includes conducting environmental risk assessments, implementing infection control strategies, and utilizing local support services. Lone working protocols and emergency response procedures are also critical components in delivering effective community healthcare. Hospital-based support roles present unique challenges and opportunities. You'll learn to navigate complex ward environments, manage routine care activities, and support patient flow and discharge planning. This training ensures smooth transitions between care settings and supports nursing teams in delivering high-quality patient care. Cultural competence is essential for providing equitable healthcare in diverse communities. By developing cultural respect, knowledge, and awareness, healthcare providers can deliver care that honors diversity and recognizes personal biases. This foundation supports effective communication across language barriers and ensures that cultural factors are considered in healthcare decisions. Supporting rehabilitation involves a collaborative approach to identifying goals and implementing exercise programs. By setting realistic objectives and evaluating progress, healthcare providers can guide patients through recovery, ensuring that interventions are effective and adjustments are made to maintain motivation and achieve desired outcomes. Managing challenging behavior requires recognizing early warning signs and implementing de-escalation techniques. By using clear communication and appropriate strategies, healthcare providers can maintain dignity and safety while documenting incidents accurately to support future planning and interventions. Specialized support in acute care settings involves understanding the fast-paced environment and recognizing signs of deterioration. By implementing rigorous infection control and assisting with complex care, healthcare providers can ensure patient comfort and dignity in challenging circumstances, adapting to specific acute care needs. Specialized support for older adults requires understanding age-related changes and conditions. Training covers comprehensive fall prevention approaches, strength and balance exercises, and strategies to promote independence and dignity. This ensures that individuals with sensory impairments and chronic conditions receive optimal care and support. Specialized support for mental health involves creating therapeutic environments and supporting individuals in defining their recovery goals. By balancing safety considerations with respect for autonomy, healthcare providers can develop skills in risk management and documentation to support individuals during periods of increased risk. Specialized support for learning disabilities focuses on person-centered planning and communication support. By facilitating access to healthcare services and implementing positive behavioral strategies, healthcare providers can ensure that individuals receive appropriate care and support to enhance their quality of life. Specialized support for children and young people involves understanding developmental milestones and providing family-centered care. By using play and distraction techniques and supporting transitions between care settings, healthcare providers can ensure that children receive appropriate support and maintain normal routines during healthcare experiences. Reflective practice workshops encourage healthcare providers to evaluate their experiences, identify areas for improvement, and develop action plans. By analyzing their thoughts and emotions, providers can enhance their practice, ensuring that they deliver high-quality care and continuously improve their skills. Assessment methods in healthcare training include observation of practice, written assignments, and skills demonstrations. These methods ensure that healthcare providers demonstrate competence in key skills, receive constructive feedback, and apply their knowledge effectively in real settings, preparing them for various scenarios and challenges. The competency framework outlines the expected performance levels for healthcare support roles. By mapping skills against national standards and gathering evidence of competence, healthcare providers can demonstrate proficiency and progress through defined pathways, ensuring that they meet the requirements for effective healthcare delivery. Career progression pathways in healthcare support roles offer opportunities for advancement through various levels of qualification and responsibility. By understanding the requirements for each role, healthcare providers can plan their career development, ensuring that they achieve their professional goals and contribute effectively to healthcare settings. Professional boundaries define the appropriate interaction between healthcare providers and patients. By understanding the risks of boundary issues and maintaining privacy settings, healthcare providers can ensure patient satisfaction and staff confidence, supporting ethical decision-making and effective healthcare delivery. Healthcare work is emotionally and physically demanding, making self-care not just beneficial but essential. You'll learn strategies for managing workplace stress, including recognizing early warning signals of burnout and compassion fatigue. The training covers techniques for building personal resilience, from physical exercise and proper nutrition to mindfulness practices and boundary setting. You receive resources for accessing support, including formal supervision, peer networks, and employee assistance programs. Supporting adoption to UK healthcare culture and practices is crucial for overseas workers. Recognizing the challenges of working in an unfamiliar system allows for better preparation and setting realistic expectations. This includes understanding the NHS structure, healthcare terminology, and professional registration requirements. By guiding through these processes, we ensure overseas workers can transition smoothly and effectively into their roles. Quality improvement is everyone's responsibility in modern healthcare. You'll learn the fundamental Plan, Do, Study, Act (PDSA) methodology for implementing and testing changes in healthcare processes. This structured approach ensures improvements are evidence-based and effective before widespread adoption. Identifying opportunities, establishing goals, and refining approaches based on learning are key steps in this cycle. Digital transformation is reshaping healthcare delivery, requiring all staff to develop technological competence. You'll learn to navigate electronic patient record systems, understanding how to input data accurately, retrieve relevant information, and maintain digital security. The training covers various digital communication platforms used in healthcare settings, from internal messaging systems to patient portals. You'll explore mobile healthcare applications that support patient self-management and remote monitoring, alongside the governance frameworks that ensure appropriate handling in the digital environment. Understanding the preceptorship framework is designed to support newly qualified healthcare support workers during their transition to practice. Recognizing the role of designated mentors in providing guidance, feedback, and encouragement during this critical period is essential. Building productive relationships with mentors based on mutual respect, open communication, and shared goals is crucial. Developing skills in receiving constructive feedback non-defensively and implementing suggested improvements is important. Recognizing the potential to become a mentor yourself as you gain experience and expertise is also covered. Successful assessment requires methodical preparation and organization. You'll learn effective portfolio management techniques, creating clear sections that align with competency frameworks and ensuring evidence is easily accessible for assessors to review. Gathering diverse proof of competence, understanding exact requirements, and preparing for practical assessment are key components of this preparation process. Completing the healthcare program involves receiving formal recognition of achieved competencies. Establishing ongoing learning habits is crucial for continuous development. Keeping competence records current and implementing learning in daily practice ensures that skills remain relevant and applicable. This completion marks a significant milestone in your professional journey, setting the stage for future growth and opportunities. Pursuing continuous professional development through formal courses, workshops, and self-directed learning is vital for career advancement. Exploring areas of special interest such as dementia care, wound management, or mental health support can lead to specialization pathways. Progressing to senior healthcare support worker positions with increased responsibility and specialist skills is another avenue. Investigating pathways to registered professions, including nursing, allows for further career progression and specialization. These steps ensure you remain competitive and fulfilled in your healthcare career.